Good day, my name is Krista Blackett, and this presentation discusses the issue concerning substance abuse in South Africa, specifically province of Western Cape, highlighting recommended strategies for counteracting these issues. Here is an overall summary of the problem. Studies show that from 2000 to 2018, the burden of substance abuse in Western Cape, South Africa has been increasing, becoming so unbearable that there isn't enough accessible treatment facilities in the area. Furthermore, in 2018, it was found that even children as young as 10 years old were treated for hazardous drug use. And so the key findings are as follows. Young person between the age of 18 and 29, specifically more males, have been found to have high association with drug use. Therefore, suggested recommendations are as follows. Firstly, mandatory youth-focused programs geared towards social guidance, prevention, and education. Secondly, increase in accessibility of treatment and rehabilitation facilities. And finally, implementation of LEVI on easily accessible over-the-counter drugs. What makes substance abuse a public health issue? Well, the answer is this. Substance abuse can be described as the use of potentially harmful substances to the point where it becomes a health hazard to the user. It can result in decreased mental, social, and physical well-being. And evident risks associated with substance abuse include the risk of exposure to infectious agents, drug use disorders, unintentional deaths, traffic incidences, drug-related crime, and violence. And the historical link is such that the increase in burden of illicit substance abuse has been as a result of the abolition of apartheid in the 1900s. The demographic structure of Western Cape is as follows, or South Africa on a whole. It comprises of primarily whites, blacks, and Asians. And the blacks refer to the South African Bantu, the white refers to persons of Dutch, German, French, English, and European descent, and the Asians refer to descendants from India, China, and Vietnam. Over the years, various regulations have been implemented by the government of South Africa, and these include, firstly, the abolition of apartheid, and that was done in the 1900s, and this was referred to as a period of political transformation, that is, and it contributed to the increase in the prevalence of substance abuse. Secondly, there was the establishment of Central Drug Authority, and that was done to steer the implementation of National Drug Master Plan. Thirdly, development of youth prevention programs. And these offered guidance on good practice rather than the one-off talks at school that has proven to be ineffective. So these would be more a continuous type of program. Fourthly, warning labels on potentially hazardous substances and also new ideas to prohibit the advertising of alcohols. Fifthly, policies for liquor outlets such as 500-meter restriction from educational, religious, and rehabilitation centers. Next, improved methods of banking and monitoring of the entry of scheduled substances. And lastly, asset forfeiture policy. Before new policies can be implemented, various aspects of this issue must be evaluated, and thus the evaluative criteria involves 1, evaluation of prevalence and causality, and so questions like, is there strong evidence of the issue of substance abuse in Western Cape? That needs to be asked. Therefore, the investigative research via cross-sectional studies should be done to determine the prevalence in Western Cape, and analytic case control study can determine and compare the level of the association between exposure to illicit substance and treatment and outcomes. Secondly, Government power and individuals' legal rights. You would ask yourself, is the government regulation infringing on the rights of the individual? Because after all, every individual has the right to social development, but they also have the right to decide on the use of drugs or consumption of anything for that matter. Number 3, economic cost benefit. Are there any unproductive or unnecessary costs being made, such as the terrifying one-off school session that has been proven to frighten students rather than create awareness, as compared to profitable interventions like continuous educational programs centered around prevention of substance abuse? Next, equity and ethics. And questions such as, are all the strategies ethical, or are interventions and contributions equitably distributed? Those questions should be asked. There are many plausible reasons for an individual's habits, one of which can be religious reasons. Thus, there must be equitable treatment at every step of the process. Fifthly, public perception. And you would have to ask yourself, is the community in agreement with these intended strategies? Once confident that the policies will potentially improve quality of life, there will be acceptance and thus cooperation. The bulk of the existing status quo is categorized into 4 groups. These include awareness and prevention, assessment and brief intervention, treatment, and aftercare. However, stressing on the implementation of the previously stated recommendations, 1, there should be equitable access to substance abuse treatment services in Western Cape, and 2, application of taxes on easily accessible over-the-counter drugs. However, prescription drugs should remain affordable, especially for the disadvantaged groups, persons who may most likely not be able to afford an increase in prices. Each of these categories is a key aspect of the combating of substance abuse. These categories all play a pivotal role in the treatment process. It's evident that efforts are being made to decrease the prevalence of substance abuse in this location. However, most of the initiatives implemented in the status quo were specific to alcohol. Thus, again, equitable access to treatment services ensures that the necessary services are provided and can easily be accessed without major barriers. Taxation is also beneficial to both individuals with a habit or the potential to develop the habit and government of South Africa, since it would be an extra source of revenue for the government. And appropriate facilities, in that the development of various accessible facilities catering for the needs of persons desiring to undergo detoxification and from specific drugs. The National Survey on Drug Use and Health is a study carried out yearly by the Substance Abuse and Mental Health Services Administration since 1990s. This trend is obvious. The rate of addiction spikes in the young adulthood. You look at the mouse, all of these, that's between age 18 to about 26, 27, thereabout. So you see that there's a tremendous spike, higher percentage of youths are addicted to illicit drugs, right? So therefore, these awareness programs, prevention programs, and treatment programs as well would therefore be beneficial, since they are expected to be youth-focused. This pie chart represents the total alcohol attributable disability adjusted life years in South Africa in 2004. This proves the need for my second recommendation, which was to ensure the implementation of more accessible treatment facilities. Steps in the implementation process. 1. Collect and combine all the data necessary for the study. 2. Carry out extensive research on previous studies. 3. Consult and work with experts and legal bodies. And 4. List expected outputs and clarify objectives, roles, and responsibilities. Then you can move forward. In conclusion, this issue of hazardous substance abuse in 2000, after the era of apartheid, has proven itself to be a current topic of concern in the geographical location called Western Cape, South Africa. Therefore, substances must be put into place to train, treat, and prevent further occurrences of health states related to substance abuse. This is the end of my presentation. The reference page